Hello, it's been a while, hasn't it? I've been so sorry. I've been really dead set busy with work. Mostly at the methadone clinic. They're short on staff. And also the schedule kind of changed up a little. So normally I have like Friday mornings like off from there, but my schedule changed a bit, so I'm still trying to figure it out. But last week I didn't have any time off at all, so I couldn't make any videos. So I apologize for that. And now I'm going to make like 3 today. Try to pre-make them and then have them ready for when, if you see his videos, this will be on Monday afternoon. So I apologize for the delay. I'm sorry. I'm finally here. I'm alive. I promise. But if you're watching, if you're new here, my name's Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and Warmium 9800 on Reddit. I never thought I'd be saying this again. It's been a while since I made a video. But here I mostly talk about nursing related materials, like stuff that's going to help you with the NCLEX, or if you're just like studying for nursing school, like materials like that. I currently have a playlist I'm building on, which is maternity, newborn, and I think it's going to be very beneficial for mostly people studying for the RN, because we need to know pregnancy, how to go about, because you can have any pregnant patient, you need to know how far along they are, and you need to look for complications, because any kind of pregnancy patient can come to any unit, no matter whether it's psych or med surg. Speaking of those, I have a pharmacology playlist of different high yield meds you should know for the NCLEX. I have some fundamental stuff which I will update the videos whenever I get a chance, that is, and hopefully when I'm done with the maternity newborn stuff, I would like to go update some videos and then move on to pediatrics. And then I have a med-surg playlist that compares and contrasts different diagnoses, because that would be needed for your NGen case study questions. So you'll see that on your ATI, UWorld, boot camp, whatever NCLEX prep you're using, you'll see those, and it's going to be good practice. And then there is a playlist for T's, but they're very old, but I feel like you'll learn quite a bit from that playlist. And you get bored with my nursing stuff, I do have a playlist for documentaries that I've done so far. I would love to do Ultimatum. Speaking of Ultimatum, I am currently watching the new season. It's really awesome so far, and I have a lot of choice words when I get ready to do season 4, but I am going to do season 2, not this week, but next week, just because I need to watch the finish of watching season 2, and I remember how explosive it was at first at the beginning. I'm starting to remember that season now, so I will get right into it and I'll talk about it. And then I do have a reality playlist as well, Love is Blind, but I'm not watching this season. That's coming up soon. And I have some other stuff on the videos you want to check out, and that's about it. So I am going to go over the teachings for the pregnancy. This is going to be very, very important to you all. Why? Because on one of the components when they're looking for the NCLEX, whether you're going for your RN or LPN, they are looking for health promotion and maintenance. Mostly for RNs in this case, because now we're talking about pregnancy. So these teachings is important for you to understand and know. So when they're asked something about teaching, and whether it's a standalone question or it's going to be in a case study, you know how to answer those questions. So with that said, let me get through each trimester and the important things to look out for, okay? So the first trimester, that's 1 to 3 months. The symptoms you're going to see: missed periods, fatigue, tiredness, breast tenderness, mild cramping or spotting, frequent urination, nausea, and vomiting. So then you can see also mood swings, cravings, aversions, heightened sense of smell. Nausea will continue throughout this first trimester, right? Constipation, bloating, increased vaginal discharge, headaches, and the uterus would have risen above, actually. So around the 4 to 6 weeks of pregnancy, the woman was going to find out whether she's pregnant. All right. So nutrition, very important for you to also know. You need to tell, not encourage, but you need to educate them that they should be taking prenatal vitamins with folic acid, which is 400 to 800 micrograms a day. And why is that? We're going to prevent neural tube defects like spina bifida. Increase protein, fruits, vegetables, and iron-rich foods, especially iron-rich foods. Avoid raw fish like sushi, unpasteurized dairy, and undercooked meat. So one of the things I'm going to talk about will be hyper MS gravidum. So I think that's going to be the next topic. Pregnancy topic. I want to talk about the different diagnoses you can see with pregnancy. So with that said, you will want them to eat small, frequent meals. Like they need to be eating carbohydrates like crackers before they're going to get out of bed. Avoid greasy and spicy foods. And safety is a really huge one with this one. And this doesn't just go for pregnancy. This is for any kind of patient, whether they are any kind of adult patient, I'm going to say. So whether they are elderly, they're a psych patient, whatever the case. Avoid alcohol, smoking, and recreational drugs. And that's goes without saying when we're talking about pregnancy in women. Limit caffeine, usually less than 200 micrograms a day. So tell them to limit that. Avoid hot tubs and saunas. And also, this is a warning sign. So no matter what type of what part of the pregnancy the woman's going through, they need to watch out for vaginal bleeding, severe abdominal pain, persistent vomiting, and fever, especially severe abdominal pain and vaginal bleeding. Because one of these pregnancy complications, we are going to talk about that, and those are the two biggest signs to look out for. Okay, this is the second trimester I'm going to get into. That's 4 to 6 months. The energy is going to has improved. It's going to be a little better. The baby bumps is going to become a little more noticeable. I just love seeing baby bumps. It's so sweet to see a pregnant lady. And I'm like, oh, that's going to be me one day. I hope so. I just need to find the right man. Wink, wink. Okay, decrease nausea, increase appetite. The skin will change, so you may see darkened nipples, and then okay. I'm kind of laughing because of the way I might pronounce it, but linea nigra, okay? I believe that's the lining that you're going to see in a woman's bump, and then it's going to be a line. I'm not sure why it does that. I think that's definitely the hormones doing that. I don't know, but that's what you may see with pregnant women. Some women, you may see that clear as day rather. And the woman will begin to feel fetal movement, which is a good thing, especially around the 18 and 20 weeks of the pregnancy. They can get backaches, round ligament pain, possible swelling of feet and ankle. So I want to put a side note here. For particularly the second and third trimester, if you see any swelling to the face, they need to go to the ER, because that could again compromise their airway. So if you see swelling to the ankles and feet, that's fine, but to the airway, that's not okay. ER now. Don't delay treatment with that. Braxton Hicks contractions, man, I can talk, may begin. They may feel heartburn, digestion, because everything's growing in there, it's moving around, and land cramps, stretch marks, and whatnot. So be aware. I'm not sure they talk about this often, but I'm going to say this because I know when I was learning pregnancy, maternity, newborn, the age of viability is 20 weeks or after, just so that way you're aware. Okay, sorry about that. With exercise, moderate exercise like walking is encouraged, or maybe like, I don't know, moderate light swimming, nothing too heavy. All right. Avoid contact sports, like I was saying, nothing too heavy, or activities with a chance or risk for falling, because that's going to cause trauma to the mom and baby. Supine hypertension can occur. So remember when we were talking about positions in one of my videos? Yes. So you want to have tell mom to avoid lying flat on her back for long periods of time. Okay. She needs to lie to the left side. Remember, I did say whenever that happens, they need to lay under left side, left, to improve the blood flow to the baby and herself, because that's what's called supine hypertension syndrome there in the back. And then you may not feel a baby, the mom could get dizzy, and it's not a fun time. Okay. So there's this thing called round ligament pain. So that's common, and it can usually be relieved by changing positions slowly. So encourage mom to change positions very slowly. So when mom's traveling, the way to put the seatbelt, okay, they need to put the lap belt below the abdomen, okay, so below the baby bump. Put the shoulder strap across the chest. They need to be taught that, because again, it's protecting her and the baby. Of course, if say an accident can occur, and it's just car safety. So make sure lap across below the abdomen, okay, and strap across the chest. Alrighty. It's the same thing I said earlier. No matter whether it's first, second, or third trimester, look out for vaginal bleeding, severe abdominal pain, persistent vomiting, of course, because she's losing fluid and electrolytes, and fever. Okay? It's fever, sign of infection. Now, for the third trimester, this is super duper important. Okay? Third trimester, that's 7 to 9 months, the final months. So she'll have shortness of breath, difficulty sleeping, because again, everything's like the baby's ready to pop out at this point. Mild edema, the hands and feet. Remember, edema can't be at the neck or the face, right? When that happens, ER now, don't delay treatment. Cholesterol may leak from the breast, so that's for the breast milk. Okay. Increased fatigue is noted. Increased infrequent urination occurs. Braxton Hicks contraction is increased because, again, baby's ready to come out. Difficulty finding a comfortable sleeping position, increased pelvic pressure. And also a big note before I continue. This trimester is where the prenatal appointments are going to be very important, and it's a must. So mom must not miss her visits when it comes to these appointments, because the baby's almost ready to go, and we want to prevent any increased complications that could occur. So teach mom, count fetal movements daily, notify the provider if there is a decreased movement, because the mom should be feeling the baby, right? So we don't want the baby to be stillborn. We want to prevent complications. So here's the signs of preterm labor, which can occur, because again, I told you week of viability is after 20 weeks. So regular contractions, lower back pain, pelvic pressure, and vaginal bleeding, leaking fluids, especially liquid fluids. So those are what to look out for. Okay. So those are the things you need to be aware of and cognizant. I will leave some links to for you to go over some signs for each trimester, what to look out for, the danger signs. And next week we're going to go over like gravidum. What's that one called? These different sort of pregnancy complications and some pregnancy diseases you may see, like preeclampsia, eclampsia, things to look out for, and etc. So I'll try to keep up and get the videos done on my next day off. I'm so sorry. Everything has been off schedule. Anyways, take it easy and have a good rest of your day. Take care.